American workers first. The package includes two very pivotal policy ideas that will help families meet this challenge: paid family leave and paid sick days. Now, the Senate must do its job. Paid sick leave and paid family leave must be included in any package put forward by the Senate. We have to pass these policies now because the truth is people are facing impossible choices right now. In New York State, many of our public schools and universities have already suspended classes or canceled in-person classes for the rest of the school year. If you are a single mother with school-aged kids, how do you choose between putting food on the table or making sure your kids are safe at home? Many Americans live with an aging parent, and we know that the elderly are most at risk. What do you do if your elderly parent gets sick? How could any of us go to work and leave our sick mother or father behind? These are the simple choices that people should not be forced to make. Sadly, they make these choices every single day. Right now, more than 80% of all American workers don't have access to paid family and medical leave. Lower income workers are even less likely. We are the only industrialized country in the world that doesn't have access to paid family and medical leave. It's worse than unacceptable. It's terrible policy. Many large businesses provide paid leave to their employees because they know it's good for productivity and for morale. Even President Trump or his advisors know it. Last year, the federal government gave every federal worker access to 12 weeks of paid family leave. This crisis has made it clear that it is essential that we extend this program to every single American. In 2013, Congresswoman DeLaura and I introduced a bipartisan Family Act, which would create America's first universal paid family and medical leave program. It creates a affordable, earned benefit that allows people to take time off to care for loved ones or themselves. It's been endorsed by small businesses and Fortune 500 companies alike. It has passed legislatures across the country with both Democrat and Republican votes. And I want to applaud Congresswoman DeLauro for working so hard to get the key principles of the Family Act included in the House's economic package. The House bill creates a new federal emergency paid leave program for those unable to work due to the coronavirus, whether it's the quarantine or because they have a loved one or child who is sick. Eligible workers would receive 3 months off of paid benefits of up to 2/3 of their average monthly earnings. We must work just as hard to make sure that this is in the Senate package that we vote on. Imagine how different this crisis would be right now if every worker knew that they could meet the needs of the loved one or themselves if they're sick, having 2 weeks of paid sick days and having up to 3 months of paid family leave. It would certainly give them calm, confidence, and knowledge that they can take care of those who are sick. Democrats are ready to work with President Trump and Senate Republicans to get this done. Now I'd like to introduce Senator Harris.
Thank you, and I want to thank Senator Gillibrand for your longstanding leadership in the United States Senate on the issue of paid family leave and so many other issues that affect our families. Here's the bottom line. Paid sick leave will save lives. Paid sick leave will keep communities safer. It's just that basic. It has always been an issue of workers' rights. It has always been an issue of what is the right public policy approach to supporting workers, understanding that every human being at one time or another will get sick, and why should they have to suffer, knowing that they either will be able to stay at home and tend to their illness or put food on the table and feed their babies or pay the rent. But with the coronavirus, it has become even more stark as an issue, which is literally there are people in America, in fact, 2/3 of low-income workers do not have paid sick leave. And when presented with the issue of whether they will stay at home while they're sick or feed their babies or keep a roof over their head, it is logical to believe that they will go to work so that they can keep taking care of their family. So in the midst of this public health crisis, let us understand that one of the most significant and effective ways that we're going to slow down this virus is to make sure that when people are sick, they stay at home, that they self-quarantine. So let's unpack the math on that. If you're sick and we don't want it to spread through the community, we want people to stay at home. If you are a low-income worker who does not have paid sick leave, if you're facing the choice of whether to feed your children or go to work, you're going to choose to feed your children, and that means going to work and perhaps spreading the virus. So what the House is proposing is not only right in terms of what we need as public policy in the United States, in terms of how we treat our workers, but this is a very smart way to address what is currently a very significant public health crisis in the United States of America. So again, I applaud Senator Gillibrand. I'd also just raise one more point. I serve on the Senate Homeland Security Committee, which is an oversight committee. And of course, part of our oversight includes over OPM. There are 2.7 million federal workers, and we have been asking the administration what they are going to do to ensure that those federal workers are receiving the kinds of protections they need as they do their job of working on behalf of the American people, often interacting every day with the American public. We have yet to hear a clear plan. Among the people who work for the Department of Homeland Security, again, we have oversight over that in the Committee on Homeland Security, TSA agents. We already have a couple of TSA agents out of San Jose, California, who have tested positive. And we have asked then Ken Cuccinelli and the administration, what is your plan to make sure that the TSA workers who come in contact with people every day, whether they're flying from Oakland to Los Angeles or coming from a foreign country into the United States, and we've heard no clear plan for what they intend to do to keep those TSA workers safe in their workplace. And then FEMA. So let's be clear, in California, as in many places around the country, but in California, we're on the eve of the wildfire crisis. FEMA workers are very important to be able to address these natural disasters. What is this administration's plan to ensure that first responders, including FEMA workers, are protected in the invariable outcome of this season, which is going to be fires and wildfires? And the additional point there is, what is this administration's plan when during natural disasters we often house people in very small areas, in very dense areas? And so again, these are issues that are raised only to point out that sadly, the administration has been very slow to really think through the challenge before us, and we want to encourage that that work will happen, and passing the House bill would be a smart way to start. And now Senator Cory Booker.
I want to thank Senators Gillibrand and Senator Harris for being longtime champions of paid family leave. We are in the midst of a global pandemic, and America is in a health crisis right now. To not have paid family leave means that this problem will compound, it will spread further, and it will last longer. It is abjectly irresponsible for the Congress of the United States of America to leave for the weekend and not pass paid family leave. There are millions of Americans who are being told right now that if you have symptoms, you should stay home and quarantine yourself for 2 weeks. There are folks who, without a paycheck, without resources, won't be able to pay their rent, will miss a car note, that will have their families spiral into financial crisis, and will not make that decision that we need everyone to make to self-quarantine. It is abjectly irresponsible for us not to put paid family leave as part of the package that we pass before we leave the United States Senate. To not act on that is endangering the health, not just of the millions of people who cannot afford to stay home without paid family leave, but to the millions of others that may come in contact with them because they do not self-quarantine. Thank you.
Happy to answer any questions. Go ahead.
A lot of Republicans seem to be on board with the idea of an emergency paid leave policy, but are bristling at the idea of including a permanent policy in this. They say maybe this isn't the time to do that. What's your response to the emergency situation, focus on the emergency and not on the long-term permanent plan?
Well, Paid sick days should be permanent because it's something that's going to make a difference long term. But our Family Act is for 1 year, and it's specifically for coronavirus cases.
McConnell just announced in a tweet that the Senate is canceling recess for next week. What is your opinion of that, given that you are trying to push for this paid family leave policy? Do you think it's wise to keep the doors open?
I do, and I'm sure every senator has their own perspective, but we have to pass a package that meets the needs of the American people now. I think when we're talking about large-scale stimulus, it is less important about it's less important to focus on tax cuts for the wealthy and corporations than it is to focus on the people who need to be at home because they're sick, or the people who need to be home to care for a loved one who's sick. And so the focus of the debate should be, how do we deal with this healthcare crisis? The second thing the president didn't even mention last night is increased testing. Available testing, you have no other alternative than to close down schools or close down communities that have been exposed to the coronavirus. And so we can get the economy running again if you have very readily available testing so kids can go back to school, so people can be at work, and that people can know whether they have it or not